While preparedness is an essential function of public health, few of us anticipated all the changes this year would bring as we served our state in a global pandemic. But anyone who works in public health knows that no matter how tough the situation gets, we show up to serve our communities, to do good work, and to forge new partnerships to make our communities healthier. COVID-19 challenged everyone in the public health community, including NCIPH. However, we were able to draw upon the strengths of our staff and partnerships to support our projects. Working with the Gillings Epidemiology Department, UNC School of Medicine, and the North Carolina Department of Health and Human Services, we leveraged a population-based community assessment cohort with the Chatham County Health Department to estimate COVID-19 prevalence and learn about its impact. NCIPH also provided guidance for synthesizing and visualizing North Carolina data for the Gillings COVID-19 dashboard. The dashboard is a collaboration across Gillings departments and institutes, which contextualizes data with practice-based insights from local public health and other contexts applicable to researchers, practitioners, and policymakers. Through our partnership with the North Carolina AHEC program, we helped develop curriculum for North Carolina's contact tracing program, the Carolina Community Tracing Collaborative. Supporting public health leaders and developing the leaders of tomorrow has always been a core part of our work. Our Emerging Leaders in Public Health program with the Kresge Foundation reached one of its core goals of training 100 transformative leaders this year, and the National Program Office at NCIPH bolstered and supported their COVID-19 response efforts, including collaboration with the CDC Foundation to collect information about agency needs for COVID-19 related resources and funding. We ended the fiscal year in collaboration with 4 talented Gillings students on COVID Behind the Numbers, a practicum project documenting lived experiences of the pandemic from the perspective of healthcare and public health practitioners. While the objective and numerical data will always be there, if we do not capture the feelings of those most affected, we lose the spirit of public health to improve the health and lives of people. While the intensity and disruptions of the pandemic overshadowed much of the year, NCIPH continued our core work. At the start of the fiscal year, we published Driving the Future, a statewide assessment of the local public health workforce in North Carolina. We hope it will guide strategic planning and collaboration in response to North Carolina's evolving public health needs. We continued our work with the Kate B. Reynolds Charitable Trust as a data partner with their Healthy Places initiative. We collaborate with the Trust to identify and track metrics pertaining to health issues such as substance misuse, adverse childhood experiences, and access to care. 2019 marked 100 years of public health nursing in North Carolina, and we were proud to continue our educational support for public health nurses, including the 36th Annual School Nurse Conference, the Principles and Practices of Public Health Nursing course, and the Enhanced Role RN training course, which prepares nurses to do physical assessments, STD tests, and cancer screenings in local health departments. We also collaborated with the North Carolina Oral Health Section to launch a new online course for dental hygienists. This training program helps meet legislative requirements for dental hygienists to serve in expanded roles to provide access to care in schools and other settings. We continued to develop public health leaders with our third cohort of the North Carolina Public Health Leadership Institute. We are thankful for strong partnership and support from both the North Carolina Division of Public Health and the North Carolina Public Health Association, and look forward to supporting and developing the next group of distinguished public health leaders in North Carolina. As we navigated the profound impact of COVID-19 on our world, we also witnessed how structural racism manifests in too many of our nation's systems, including public health and healthcare. We stand in solidarity with the Gillings School of Global Public Health and others who have declared racism a public health emergency. Supporting all communities in North Carolina is one of NCIPH's core values, and we are proud of our ongoing work to support health equity. As in past years, we provided support to the student-led Minority Health Conference and led the planning process for the 25th Annual National Health Equity Research Webcast. With significant support from the North Carolina AHEC, we partnered with Gillings Inclusive Excellence for the inaugural Inclusive Excellence Summer Symposium, designed to create inclusive classroom spaces and to address curriculum gaps around diversity, social justice, and equity. We also hosted online workshops through the Racial Equity Institute that presented on the nature and impact of structural racism, including how to use data to measure the systemic impact of racism and to track institutional change. We're proud to serve North Carolina, and we're humbled by the dedication of our public health workforce across the state during this extraordinary time. Passionate, committed people have always been at the heart of our work at NCIPH as well. Amidst the struggles this year brought, we found many moments of joy and connection, even over Zoom. From meeting our new work-from-home supervisors, to figuring out how to get some peace in the home office, to learning the ins and outs of Zoom etiquette, to celebrating each other's joys, we've prioritized caring for each other as we care for our community. We wish the same for you in the years to come.